All right. So we are on Facebook Live, Geaux Rouge. I am sitting with some wonderful mental health professionals. What we have scheduled for today is something we've entitled Geaux Rouge Mental Health and COVID-19. The folks from Dr. Romano's office have been good enough to give us some of their valuable time to chat with us about some things that might be going on right now in your life. My name is Franz Borghardt. I host the Geaux Rouge show on Talk 107.3 and run the social media page. Before we get into introductions, guys, if you're watching this and you have questions along the way, I'm keeping an eye on the questions. And if it's something that we can kind of discuss, I will certainly toss it out to our professionals. We're going to start with Dr. Romano. Dr. Romano, please introduce yourself and the wonderful team that you have on this call.
Sure. It's Dr. Brandon Romano. I'm a clinical psychologist here in Baton Rouge. We also have Shannon Smith, who is a licensed professional counselor in our practice as well. And we have Dr. Sonia Blauvelt, who is also a clinical psychologist in our practice.
Dr. Sonia, we can start with you. Tell us a little bit about yourself.
Okay. Well, I've been working as a clinical psychologist with Dr. Romano's office. I've been in with his practice for, I think it'll be almost 3 years coming up. And I treat a range of general concerns such as depression, anxiety, trauma, disordered eating, and people with sexual problems. I mainly work with adults.
And Ms. Shannon, how about you?
Well, as Dr. Romano said, I'm a licensed professional counselor, and I've been with the practice for almost 5 years now. My background is in working with victims of domestic and sexual violence, and from that took an interest in working with people who commit sexual and domestic violence. So that's one of the focuses of what I do, and I primarily work with teens and adults.
So let me start with an easy question. I know a lot of people that normally go through counseling, either through my practice of law or just in general as a human being. And the question I keep getting asked is counseling, is therapy still happening with everything that we have going on? It's kind of a softball question, but I think it bears answering. So Dr. Romano, I can't just say doc because we got two docs on here. Dr. Romano, can you answer the question of how are you guys still providing treatment, therapy, and evaluations?
Sure. So we have to obviously follow CDC, CMS, LDH, and other local, state, and federal guidelines and regulations, but we're primarily seeing clients through telehealth, video, and telephonic through telephone. And, obviously this is to protect everyone, the health and safety of clients. There are some cases across the board where for clients, if it's not possible to do telehealth or telephonic sessions, then we can have in-person sessions as long as we're following all the guidelines of social distancing and sanitizing and so forth. I think relatively soon we may start seeing a gradual lessening of some of the restrictions given as we start to, which we all assume, going into phase 1.
All right. So let's talk about some of the things we might expect to see as a result of being on what I'm going to unprofessionally call lockdown. And by the way, shout out to Chelsea and Teresa. Y'all are attending the webinar as attendees. And if you guys have any questions that you want me to ask the panel, just message me and I'll ask them. But let's start with some of the things that we might suspect to see manifest as a result of being on stay-at-home orders or not being able to work or just with all the stuff that's going on. So Sonia, I'm gonna punt this one to you.
Okay, so I guess in terms of eating type of symptoms and just self-care in general, of course, being in a pandemic is unprecedented. It's thrown everyone's routine off schedule, no matter who they are. I don't think anyone's life has been unchanged by this. So something I've been noticing is that people that have struggled with eating or with dieting or just even managing self-care in general have had some difficulty, one, with maintaining a routine and also struggling with, having almost like this stockpile of food at home. A lot of us are privileged to have enough food at home right now, having unlimited access to that food and also not having a routine anymore. So all of that kind of makes for this perfect storm of snacking a lot, maybe just eating a lot between meals, having different meals than they're used to. And that's been a challenge that a lot of my clients have been facing right now. So in response to that,
Mhm. Go ahead.
Oh, so in response to that, I tell them like, it's not the end of the world if you're eating more than usual right now. If you're gaining a little bit of weight, that doesn't change the fact that you have value and you're a worthy person. And, there's a lot of negative emotions surrounding those changes in eating and what it might mean for changes in the body or changes in appearance.
So there's a I guess an unclinical phrase called eating your feelings, that we're all kind of universally acquainted with. Can you talk a little bit about, from a mental health standpoint, why it is that we turn, and you and I have had this talk before, but for the benefit of anybody who missed your excellent presentation on the Geaux Rouge radio show, can you talk a little bit about why it is, from a psychological standpoint, from a mental health standpoint, why is it that we turn to food when we're stressed or when we have anxiety or any number of those things?
Sure. Yeah. So you're exactly right. Emotional eating or eating your feelings is not a clinical term, but we use it to describe when we eat in response to our emotional experiences. And one, I would say it's a totally valid and normal response. Eating for emotional reasons is healthy in most cases and is a good response to, socializing, being a part of society. It's healthy and normal to get pleasure from what we eat and to eat emotionally. Unfortunately, when it's our only coping strategy, that's when it becomes a problem. So I would say that it's a normal part of our lifestyle, and maybe the society or the culture that we live in, or diet culture, tells us that eating for reasons other than hunger is not correct. So it's maybe those kinds of messages to question versus whether eating is good or bad during this time.
So, Dr. Romano, from an evaluator's standpoint, people that necessarily have not gone to therapy or counseling up until this point in their lives may be experiencing some things that one, they're not used to, and two, may be connected with eating, use of alcohol, use of drugs. Talk a little bit about what you're kind of seeing. And again, you and I have had this conversation before. Talk a little bit about what you're seeing and what you would expect to see with the way that people are dealing with what's going on, especially with somebody who hasn't been evaluated or been treated before.
So obviously every individual is different. So everyone is reacting to COVID-19 in a different manner. Some people are coping better. Some people are not coping as well. Shannon's going to talk a little bit about some of the special issues that we're seeing with domestic violence and matters like that. But I would say predominantly what we are seeing across the board is an increase in depression and anxiety and stress. There's also reports of cases of PTSD. There's even now reports, and you and I discussed it recently over texting, of nightmares.
Right.
Obviously what's happening here is everyone's world. There's not one single person out there that has not been affected by this across the country, across the world. So people are, fearful of the virus itself, right? And what could happen to them and their loved ones and their coworkers. People are concerned about losing their jobs. People are having to learn how to homeschool children, which they've never had to do before. People are social animals. We want to be with other people. We want to socialize. And we can't do the majority of these things, 75% of these things that we can't do anymore. And we're being confined. We're being restricted. Our movement, everything, our freedom, all that is being restricted. And what happens in those cases is that we're experiencing an adjustment reaction. We're having difficulty adjusting to this. I hate to use the word new normal. It's being overused at this point, I think, but this change in our lives, these major changes, are causing people to become depressed. People who may have never been depressed in their lives are feeling depressed. They're feeling hopeless. They don't know what's going to happen, how they're going to pay the bills, how they're going to educate their kids, if their loved ones in another state are healthy or not. That's, and then depression, anxiety, I always call them brother and sister, right? And so people are anxious, they're worried. That daytime anxiety is flooding our nighttime. It's flooding our dreams. It's creating these weird or unusual dreams, right? Because anxiety and things that we think about during the day, we end up processing through all the neurobiological components. We process them at night. And leading into, what Dr. Blauvelt was saying, we don't get the right amount of sleep. Our sleep is being disturbed. It affects our metabolism. It affects our heart rate, diabetes, everything, right? Cortisol release, weight gain, all these things if we're not sleeping adequately. And furthermore, there's some individuals reporting PTSD-like symptoms, the trauma, the exposure to, is my life in jeopardy? Is someone else I love or care about, is their life in jeopardy? Is someone in our life so ill that they may be leading to death, or have they passed away? So we're seeing a broad range of everything from just minor stress and irritability all the way to PTSD type symptoms.
So I'm ready to stop having weird dreams. That's just me. This morning is a classic example of, I was in a drive-through to get some coffee, and a nice lady 2 cars in front of me literally lost her stuff because McDonald's was not giving her a first responders essential employee, whatever, discount. And I'm looking at this woman confronting the drive-through recording device. She gets out of her car. She's screaming at it. She then speeds around the corner and is yelling at the poor checkout person. And I know this because I can hear her 3 cars back. She's screaming at the man. I want to talk to the manager and all this. And I'm thinking, man, and in the moment I'm thinking, man, this is just a little small discount. Is it really that necessary? And then I had to kind of had to take a step back and acknowledge, man, everybody's dealing with stuff differently. And maybe what's setting this person off is that small cup of coffee discount that she didn't get because they weren't going to give her that. So PTSD, I want to talk about that. I am by no means a mental health expert. I know enough to know that I don't know a lot. Talk a little bit, and I don't care who does this, talk a little bit about PTSD and how that's going to manifest itself. Is it going to manifest itself now for some people? Is it going to manifest itself later for other people? Because normally when I think of PTSD, I think of the soldier that comes home from a war that's still dealing with stuff 3, 4, 5 years later. So I don't know which of you would be perfect for that.
I can say a couple words.
I've had this conversation with some people I work with who are in the medical field.
Okay.
And they are very much in triage, in the trenches right now, like you talked about. They are in the battle zone right now. So those individuals are not experiencing PTSD yet, though we do anticipate that they will later. They are, processing some of the things they're seeing, but they're trying to stay focused more on the moment and dealing with what's happening as it's happening. And they're consciously aware that it's going to take a cumulative toll. So I do anticipate with people who are working in first response right now, for grocery store clerks, whoever knew they would become, our primary line of workers, for people who are delivering the mail, for people delivering packages, for those people working every day and interacting with a lot of people, they may experience PTSD symptoms later, because it's a matter of kind of dealing with what has to be done in the moment. And right now they're in survival mode and they're surviving day to day. And once they have an opportunity to slow down and take a deep breath and reflect on what they've been through, especially those medical providers and people in nursing homes, people in the funeral industry. I also have clients in that industry. Those individuals I anticipate will experience PTSD symptoms later.
May I piggyback on Shannon?
Absolutely, Doc.
So Shannon's absolutely correct. And, one of the first things that we look at is diagnosing acute stress disorder. And then after a period of time, that can go into post-traumatic stress disorder from an evaluative diagnostic standpoint. One of the studies that actually came out after Hurricane Katrina, I was actually working for Health and Hospitals, Tulane, LSU, a lot of universities had done studies on Katrina. And at or near the 1-year anniversary, PTSD symptoms started arising. It was a year after the event that they started seeing, and they actually did studies on this, of post-traumatic stress occurring because everything we're going through is traumatic. I mean, this is all trauma. It's how we process it and our physiological makeups and how it manifests later on. But the only other thing I want to say is, repeatedly, one of the best protective things you can do, and I'm sure we'll talk about that, and Shannon and Dr. Blauvelt will talk about it as well, is one of the best protective things you can do during times like this, and it's been shown in studies with PTSD, is to not ignore it, is to talk about it, is to process your emotions, is to discuss your feelings, discuss your thoughts with other people. It doesn't matter who. It doesn't have to be a therapist on the front end, but holding it in and not processing it is more likely to cause problems later on than actually talking about it.
So, you know, there's an irony in that, because it seems to the unprofessional eye, that seems counterintuitive. All day long, I try to stay busy. Just going back to what Shannon was saying, I try to stay busy. I have my little emotional construction crews building up those little walls. And it's only when I get home and it's quiet and I have to deal with stuff that I start feeling rotten. And so I hear what you're saying, Dr. Romano. It just seems so counterintuitive. So let's piggyback onto that last statement about it doesn't have to necessarily be a professional. Maybe it's a friend or something. What would you guys recommend at this point? Let's say hypothetically, you're not in a position where you know whether or not you need therapy, you need counseling, but you're unsure and you're not really, you know, what are some good first steps? You know, do you try talking to a friend first? Do you see if that works? What do you recommend?
Sure. So I can answer this
Granted,
one.
this is directed at you, or it's not, you can have it.
Okay. So I think, like you said, talking to anyone can almost help. So it could be a friend, it could be a partner, it could even be like a child who is of the age where they could maybe talk about feelings, or just recognize that, like, oh, we're not feeling that great like right now. Let's maybe come up with a way to solve how we're feeling or to change our emotion a little bit. So it can really be anyone. And, you know, this is something I learned while I was, you know, traveling from school to school, being separated from friends and family on a regular basis while I continued my education, is that sometimes having conversations with acquaintances, or even with like a delivery person now in a distance, but having just a meaningful interaction with any person any day can meet a need for social connection more than we might realize. So it doesn't have to be this really meaningful conversation about every emotion that we're experiencing and how it's affecting us, but all of these like little conversations over time can add up to make meaning in our lives.
I find that the most satisfying part of my day, besides spending time with my wife and child, is when I go to La Divina Coffee every morning and have a 5-minute conversation with the staff there over a cup of coffee, because it's pretty much the highest level of interaction I have all day with right. people. I want to, before I get to Shannon, and I do want to talk about violence, domestic violence, and some of those things. I did have somebody ask me about social interaction as it relates to Zoom and phone, texting. You guys are all mental health professionals. What would you recommend right now? And it doesn't have to be Zoom, but more so video, anything, or what would you recommend in terms of getting the closest thing to social interaction you can get in the absence of being able to give somebody a hug?
So if I want to field this one just real quick, and everyone else can add to it, I think that's excellent. I think making the phone calls, texting, social media to a degree, right? Because at some point we can become inundated with too much. You know, I've told several of my clients, take the media in doses. You know, some people have become obsessed with it, and they're watching and listening just day in and day out. And then they're going to bed with their phones, reading articles. I think you need to take it in doses, because I believe that it is certainly exacerbating any anxiety and depression you may have. So I think it's good to stay informed, but not to be immersed in it. if that makes sense. And I think having that social connection, again, going back to us being social animals, communicating. I talk to, if I have to go to the grocery store anywhere or I have any casual contact with anyone, we end up bringing this up, just whether it's 2 or 3 minutes, we talk about it. And I have certainly personally found that very helpful because it lets me know there's comfort in knowing, although it sounds morbid in a sense, knowing that other people are going through the same things that we're going through and they're experiencing the same emotions. There's a little bit of comfort in knowing that we're all in this together. So I certainly recommend that. I do not recommend you going to bed at night with your phone. You need to leave your phone somewhere else and detach from that and try to get yourself back into a normal routine, which can help reduce the depression and anxiety and the stress and the nightmares and all that.
I think one of the great things that may come out of this is that we are moving a little bit away from the simple text and a little bit from the social media connections to people, and that we are wanting to see people's faces and do the video chatting more often. I'm one of 5 kids, and we're lucky to have both our parents still. And we've had family Zoom nights that, we're not that kind of family, but it's brought us all closer together. And having a social hour or something set on your schedule with your friends can give you something to look forward to in a week. I think a lot of us are experiencing that every day feels like Groundhog's Day, right? We're not leaving the house. So what's the difference between a Saturday and a Wednesday? So to have something to look forward to can be really, good for your mood throughout the week. And it is good to see each other's faces. Like Dr. Romano said, to kind of see that we're all in this together, to get that sense of peace when we see our loved one and our friend and we see their smiling face. And for me, it's been an opportunity to take off my counseling hat because I'm doing this video counseling all day long. And now I can just be Shannon and I can just hang out with my friends and my family and laugh and, remember good times and talk about the next time we might be able to get together. I've got friends all over the country. So to me, this video format that we're using to socialize, I hope is something that we'll continue to use because it has been a lifeline for a lot of people to not feel so alone and isolated.
Sonia, you got anything to add?
I totally agree with everything that Dr. Romano and Shannon are saying. And something I've noted that was interesting is that a lot of the clients I've seen who were previously lonely are the ones that are doing the best right now because they've been used to not having a huge social circle for so long that they're kind of, maintaining that baseline. So that's something interesting that I found is that people that are social and were otherwise functioning really well are the ones that are struggling the most with not having those connections anymore.
So as someone who craves and thrives on attention, I can tell you it's tough.
Mm-hmm.
I can tell you it's tough. From firsthand knowledge, it's tough. Dr. Romano and I, say again?
There's actually been, I've read some articles that said those who are introverted will weather this storm better than those who are extroverted for the obvious reasons.
So I thrive, joking aside, I thrive on routine. So I've just been trying to give myself some kind of routine that can accommodate what's going on. Before I let you guys kind of open up some other topics, there's one more thing I want to talk about. And again, if you're watching in Facebook world, shout out to Lauren, Teresa, and Chelsea, as well as all the people watching on Facebook Live. One of the things I want to talk about is something I've talked to Dr. Romano about, which is the difference between hopelessness and helplessness. When this thing started, I commented to Dr. Romano on another program that there seemed to be this air of I can't do anything to help. In the hurricane or in a flood, I can help somebody remove sheetrock. I can do something, but there is that sense of hopelessness or helplessness in this situation other than the mandate of staying somewhere away from all other human beings. I want to talk to you guys about how you would recommend the listeners address this idea of hopelessness or helplessness.
Sure, I can take this question. And, I think I agree with you. I think a lot of people are feeling really helpless right now. And, you know, like you said, the thing that is helping the most is staying home, is keeping distance, is, you know, following all of the recommendations for washing hands and not touching our faces. So the more that we can, you know, accept that this is, like Dr. Romano said, like the new normal, the new lifestyle that we have, like that is what's helping right now, and kind of reframing the thoughts of what helping might have looked like in the past, or what it has looked like in the before, what it has looked like before can be kind of just changed a little bit to accommodate for right now. And maybe we can turn inwards and start helping ourselves a little bit more than we've been used to doing. If we're usually, you know, caretakers for other people, or if we're used to supporting our family, now might be the time to work on ourselves and kind of develop different interests, develop coping strategies, emotional regulation skills that will really be helpful once we get through this together.
So Chelsea Borrano, who is a huge advocate for helping people with anxiety, writes the question, and I'm gonna let this one be answered by Shannon first. What would you say to someone who is having anxiety about going back to normal? I'm finding myself enjoying the simplicity of it all, and I'm worried about having to go back to the many commitments and stress, especially anticipating all the events, the meetings, etc., that will likely be planned as people rush to connect. So, Shannon, how about that? The anxiety of going back to normal.
First of all, Chelsea, you're not alone. I am having this conversation a lot with my clients, and I'm thinking about it myself. You know, I believe what we need to do is to honor those feelings that we're having, to pay attention to what we're anxious about, to be able to name what we could do to minimize some of that anxiety. So it might be that we have to create better boundaries for ourselves. Maybe we need to say no to some of the meetings for a while. Maybe we need to say, I've got somebody at home who is high risk. Therefore, I'm going to continue to limit my social interactions for 2 weeks or 3 weeks, or until I feel safe. You know, it's about really kind of honoring where you're at and communicating that to people, and knowing that that's okay. And with any anxiety, the more we avoid something, the greater that fear becomes. So eventually we do have to take some baby steps. If you haven't left the house in a couple weeks, take a drive somewhere, you know, where you aren't expected to be anywhere. Just kind of go out or go for a walk. Kind of gradually get yourself back into work or to the world. If it's meetings, you know, maybe start with a Zoom meeting, and then I can do 1 in-person meeting a week. You know, I can do 2 per week, whatever it might be. You just have to be aware of how you're feeling and be able to take it slowly and just communicate that to other people. I don't think that Chelsea is going to be the only one feeling that way. We don't know enough about this virus and treatment, and we haven't had enough testing. You know, there's just so many questions, and with questions comes anxiety and fear. And so we just have to face those fears, but do it slowly and do it in a way that feels safe for each of us individually.
All right, let's change gears a little bit, because I want to get into some of the topics that you guys sent me. So I'm going to start again. I'll give Shannon double duty. Let's talk about, we're going to change gears towards what I do for a living, which is I do criminal justice. Mm-hmm. And of course, everybody who doesn't have letters after their names have theories about what's going to happen as a result of what's going on. Talk a little bit about domestic violence. And then I want to talk about substance abuse and co-occurring disorders. But we're going to start with domestic violence, and we'll let anybody chime in who wants to chime in. Okay. So Sonia, you're up first.
Okay. Well, in terms of domestic abuse and just interpartner conflict, I've been hearing a lot from clients that are just, you know, they may have already been in treatment to work on partner issues or to deal with communication skills, and now it's just all been amplified as they are home with their partners. And I personally haven't had any experiences working with anyone during this time who's been struggling with violence within the relationship or an abusive situation. It's primarily surrounding communication issues, setting boundaries, even just being assertive with a partner or with a child who is not giving privacy, not allowing for expression of emotions. So a lot of the work I've been doing is around communication skills and making your needs known with the people who you are isolating with. So I don't know, probably Shannon could speak more about specific domestic violence issues or child abuse or neglect.
I think I said Sonia. I said Sonia, but I meant Shannon, and I'll piggyback onto something you just said, Sonia, which is something I do want to talk about. I have a 4-year-old little munchkin who is literally living his best life right now. He's playing with mommy, he's doing arts and crafts. And like, we thought it would be the opposite. We thought, man, being away from his routine, he would be upset that he's not in pre-K 4 and all this. How are we going to get that boy back in school one day? That's going to be the question I have. But I meant to say Shannon when I said Sonia. Shannon, you can talk about domestic violence.
And I think it worked out perfectly because there is a difference between relationship distress, which I think a lot of people are experiencing right now, being 24/7 with your loved ones and your family, and domestic violence. And domestic violence really is more about a pattern of control and abuse. And what scares me, and again, I'm not working right now with anybody who's experiencing this, but the concerns are that what's happening in isolation right now is exactly what happens during domestic violence, that resources are limited, that an individual is isolated from their friends, family, and support. In terms of child abuse, most child abuse suspicions are reported by teachers and by individuals in the community that run into those kids on a daily basis. So calls to child abuse hotlines are down because we don't have those third parties who are watching the kids and calling in their concerns. So we probably have a lot of domestic violence and child abuse that's occurring that's unknown right now. Whether women in domestic violence abusive situations feel like they don't have a shelter to go to, they may worry that shelters are closed during this time. And some of the smaller shelters probably are, especially those who serve, say, single sex relationships or trans clients, or they don't have the big funding sources that battered women's programs typically have from Violence Against Women Act. So, the resources are limited and our surveillance of this is limited right now. So we don't know for sure how big the problem is, but we can extrapolate from what we know about domestic violence and control, manipulation, isolation, that women, children, and men who are in an abusive family setting right now are feeling those types of isolations in a greater way than they ever have before, and that the risk for violence is heightened because the economics may be strained. There's access to alcohol, probably access to guns because this is South Louisiana. And, the potential is there. And I've been watching the news and noticed more instances of individuals, especially individuals in law enforcement, who have been charged recently with child abuse or domestic violence.
So the world kind of seems on its head right now. I made a very snark social media post about a video I watched where there was a gaggle of mothers at a park with kids and a law enforcement officer. These are all what we would normally deem as law-abiding citizens. And they were confronting this poor police officer who couldn't have been nicer. And these are none of these people would probably be, and I don't know, but wouldn't be anybody that you would say have rage issues and anger issues. Maybe they do, I don't know. So the world has kind of turned on its head. But in the world of domestic violence, and I deal with it. I've dealt with it on both sides. I've dealt with it in terms of being a former prosecutor, and I've dealt with it in terms of being a defense attorney. Let's address both sides of that. Okay. If you're someone who's in a volatile situation like that, and you've got economic issues to consider, you may have have residence issues, like where are you going to stay? What is your advice for that person? I mean, besides obviously get out of the situation if possible.
Right. My advice is no different than it would normally be. It would be to create a safety plan and to talk to other people. Domestic violence occurs because it happens in silence and secrecy, and it can only end when we reach out for help. So to communicate with family, to talk about what's happening, to have an escape plan, the same things that would normally be in place. And all of the online resources are available. As far as I know, IRIS, our domestic violence shelter in Baton Rouge, is operational and accepting people into shelter. So to reach out, 211 is a great resource as well, easy to call and ask for some help. But again, it starts with telling people what's going on instead of hiding in your home and thinking that you're the only one feeling this way or that nobody cares and will be able to help you.
So that piggybacking onto that last statement, I had someone private message me and say, and anybody can field this question. They're saying essentially, I want to ask people for help, but I also don't want to be tone deaf to what is going on. And so I have not been reaching out because I don't want to seem insensitive to everybody else because they're dealing with stuff too. What would you guys kind of say to that?
Well, I guess I can answer that question. And, I think it's easy, and I think it's been going on right now where people are almost like policing how bad certain others have it and comparing ourselves, like that we're doing better off or worse off than other people, or that people's devastations that they're experiencing aren't as bad because someone else is experiencing something worse. And I would say that, when it comes down to it, no one person is worth more than anyone else, and no one person's suffering is more or less meaningless than anyone else's. So absolutely, like there's providers here to help you. We have openings in our schedules. You wouldn't be taking up someone else's time that needs it more because you need it just as much as anybody else does. Right. So I would say that, I think this person who messaged you is displaying like a great deal of, self-awareness of their thoughts, that they're thinking of that during this time. And at the same time, help is there for whoever needs it.
And, to kind of follow up with that a little bit, it kind of dovetails a little, but not entirely, is that everyone is suffering, Franz, in the context of their own life, right? I mean, males and females, rich, poor, every religion, everyone is suffering or experiencing something in the context of their own life. Whatever factors that you were dealing with before are now exacerbated, right? So I think one of the things is that for the person who private messaged you, is that it's okay because everyone is experiencing some form of suffering, and everyone is being, I can say, there are some people who are not being very nice out there, but I've encountered more people being helpful than not lately. And I think if someone has their own anxieties about reaching out for help, it goes back to what either Shannon or Dr. Blauvelt said earlier, is that the only way to get through anxiety is to challenge it, is to face it head on. It's like, the fear of heights, and taking that elevator all the way up to the top of the Empire State Building. There's ways to get through it, but you just have to tell yourself that it's okay to reach out, because I don't think you're asking for any more than anyone else is.
So anxiety, depression, trauma, PTSD, and good old-fashioned substances that we like to abuse. I want to talk a little bit about that because it's one of the few psychological principles that I get to deal with on a daily basis, and I somewhat understand in so much as I don't understand it. I would imagine, I've ventured to guess that we're going to see a spike in substance abuse.
Yes.
Fair assumption?
I think so. And I've run substance abuse facilities. I've run inpatient facilities, and I've dealt with people on outpatient basis. And we in this practice also evaluate professionals with substance abuse problems. So we have a decent grip on it, I would say, among all of us in and on and not on this conference. One of the things those who have already had pre-existing substance abuse problems, I do fear for those individuals the most, because if they have used substances, and when I say that, I mean prescribed, like misusing your prescription medication, illegal substances, alcohol, cocaine, LSD, alcohol, legal substances, illegal substances, prescription, everything across the board, is that individuals have a proclivity to turn to those to numb their feelings, to deal with the anxiety, to deal with the stress, to deal with the depression, and sometimes just drink so you can fall asleep, But what ends up happening is alcohol disrupts our mood regulation. It disrupts our sleep cycle. It can contribute to nightmares, which we spoke about earlier. And alcohol, a lot of people with PTSD, I've read studies, I've actually found through working with individuals with PTSD, alcohol seems to be the biggest or the largest substance that is used with people, mostly with the veterans I have seen through the years. When there is a substance, I can 9 times out of 10 guess it's going to be alcohol that they are using as opposed to marijuana or cocaine. But the problem again, the substance use is a double-edged sword. Right? You're using it to deal with the emotions and the feelings, but it is also a chemical that changes your mood and alters your perception. So that could easily dovetail into what Shannon's talking about, domestic violence. You're using substances to deal with the emotions, but it's actually making you more emotional, which could lead into the abuse and the violence and exacerbate depression, lead to suicidal thinking, even lead to suicidal behavior.
Suicidal behavior. We haven't really been seeing a lot about that in the media, but I, again, would venture to guess that we're going to see that. Fair assumption?
I believe we will. I read an article recently, actually the first article I've read about suicide, although we all have our own hypotheses about what's going to happen, with the suicide. But there was a young girl, maybe 16 years old, that was quarantined for 30 days. I may be getting these numbers off, but the general point is she said at some point 30 days felt like 30 years to her, and she could not tolerate it. And she committed suicide. Because adults, we understand if we want to be social, imagine teenagers. And I know, I'm probably the only one on this call that has 2 teenagers, but their social life and their friends and go and play their sports and their team sports and baseball and football and being with each other in school, all that's been stripped. They're down to just their family and video conferencing. But that was the first article, Franz, that I've seen about a suicide, although we do know there's more out there. We just haven't seen it.
So let me ask you a question from the layman's perspective. What, if I'm a caring human being, which I like to think I am, what am I looking for? If I start getting certain things, what would those things be if I need to be worried about one of my friends or loved ones and this idea of suicide? Because on the one hand, it seems like everybody's acting differently because everyone's acting differently, right? On the other hand, is that acting differently necessarily a manifestation of having suicidal ideations? So back to the question, what, as a good human being, what should we be looking for if we're concerned about somebody?
This is a difficult question because we do know that many people who actualize suicide never have any warning signs, never let anyone know what's going on, and that there was nothing that anyone around them could have seen or done differently. But some of the things that we would say that could be warning signs would be somebody who is talking about feeling very hopeless. They don't see a future. They don't see themselves in the future, that they're feeling worthless, that they're talking about that they're a burden to others or they're not important, that they can't earn a living and therefore they're worthless, they're not good enough for their family. Those kinds of things. There are other things that I don't know that we would see right now, but giving away possessions, writing notes to people that seem kind of cryptic and as if a goodbye note. But again, there's that huge caveat of that we would never see signs, and for most people, there are things that we would miss even if we're looking.
And kind of to piggyback off of that, so while I was in grad school, I did a lot of research on suicidal behaviors, and I've actually authored a chapter on theories and predictors of suicide. So what Shannon is saying is right. It's kind of those statements about hopelessness, about the future. It's a sense of not belonging. So it's often not someone that you may be friends with. It may be someone who is completely isolated and doesn't have much social connection. And then it's perceived burdensomeness. So feeling like you're a burden on the people around you, feeling as though others have to caretake you, are often the emotions associated with suicidal behavior or committing suicide. But things that we can look out for our friends are like drastic increases in substance use, whether it's alcohol or other things, sudden changes in moodiness or irritability. Insomnia is a predictor of suicide. So like you're saying, there's a lot of overlap with what's going on right now and what could be a predictor of suicide. So one thing that's really important to consider is that talking about it with someone is not hurtful. There's this kind of myth perpetuated in society that if you bring it up, you'll give someone the idea for them to hurt themselves, but that's actually not true. So having a conversation, just reaching out and talking about it is not a bad idea.
So, it's interesting because Dr. Romano and I were talking the other day about this. It's the anxiety of what do you say to somebody? Not just in the context of suicide, but in general, it's kind of like when someone loses a loved one and you're like, how are you doing? Well, it's kind of a stupid question, right? We know how they're doing, but it's not meant to be that question. And Dr. Romano, actually, we were talking about this, had a very good point, and not to steal your thunder, Doc, but had a very good point that maybe the better question is, what can I do for you? What is there that I can do to help you right now? Because, I see a million people and my default question is, hey, how's it going? What's up? And you don't want to be that person that's asking that, but that's kind of, all right. So we're doing great on time, guys. We've got about 10, 15 minutes left. I think it's important to point out all these guys are working with Dr. Romano. And Dr. Romano, if they want to get more information about you guys and help, where would they go to get that?
We have a Facebook page, and also our website is www.romanopsych, that's ROMANOPSYCH.com. And you can learn a little bit about the providers. You can learn about the services we offer and our locations, and how to make an appointment.
Cool. And y'all are doing video evaluations, video treatment, therapy, counseling. Those are all things that you guys can do, right?
Right. Our office is open, and everyone's situation is obviously different, but we still have people answering the phone. So if you call, you can make an appointment.
All right. So before I let you guys give your best piece of advice for what's going on right now, I feel compelled to go back to food, Dr. Sonia. Tips on how to keep your sanity and eat to where you're not going to walk away from this 20 pounds heavier. I've gotten a few messages from people that will remain nameless about, hey, look, I'm trying to be supportive of my community, the businesses. I'm trying to eat out. I'm trying not to gain the COVID-20 or whatever they're calling it. So any tips you have for people right now in terms of their diets, whether it's go vegan for a couple of days, whether it's pescatarian, whatever you got.
Okay. Well, first I want to say, don't restrict what you're eating during this time. I mean, especially right now, all the news that's come out that COVID-19 is hitting obese people harder than others. So there's been kind of this uptick of people going on crash diets right now, unfortunately, hoping to, thwart weight gain, but that will risk your immune system. So I would advise not making drastic changes to your diet at this time, doing what you know, and having some self-compassion for yourself. I mean, it's okay to gain a few pounds. Over the course of our lives, we do gain and lose weight. And you can still eat a balanced diet from restaurant takeout. it is possible.
I've got to ask you this question, and I've been wanting to talk to you about this. And since I've got 3 trained mental health professionals, I can't miss this opportunity. Our entire concept of self-image has been thrown out the window.
Mm-hmm.
We went from this world where we had this concept of what beautiful is and all that, to now on social media, people are just straight up like, I'm in sweatpants and I don't care. I love it. I love that, that is what's happening right now. Can we speak towards that at all? Because I'm in such a, if there's one thing that I wish would stay as a result of this, it would be that our modified sense of self-image.
Mm-hmm. Yeah, I think there's almost, oh, sorry, go ahead.
I was going to say it's not so great for everybody. So I work with people who are transgender and gender nonconforming. And for a lot of those individuals, they've had a lot more body dysmorphia during this time, some gender dysphoria, either seeing themselves on camera in a way that they're not used to seeing, hearing their voice transmitted in a way that they're not used to, or not putting on makeup, not doing their hair, not dressing the way that they would normally present, and feeling kind of, not so good about themselves, as well as not wearing binders, which are not good for you to wear all the time. But many people wear binders out of necessity to keep down that body dysmorphia and present the body image that they feel best in. And so not wearing the binder for a lot of people feels good physically, but then emotionally feels really bad that they're experiencing a lot more dysphoria. And so I think for some of us who like to think we're pretty low maintenance, including myself, it's been great not to do my hair or put on makeup or do all of those things. But I've been conscious of my clients telling me the reverse, that for them, not going out and presenting and not putting on the clothes and the makeup or the binder and the clothing that they would normally wear has made them feel a little less comfortable in their own skin. And I think for even a lot of us, seeing ourselves on camera for the first time, hearing our voices, being on a video is not comfortable for anyone. So I think a lot of us are kind of looking at, oh my gosh, is that what I really look like? Is that what I really sound like? So there's some comfort in how we feel at home, but now we're presenting that to the world and we're wondering, is the world judging us as well? So we do have to all work through that in our own head. Self-judgment.
So this is a safe space. I can be honest with my feelings and emotions, right, guys? I was at a grocery store in Central yesterday picking up a bottle of something, and there was a nice, well-dressed lady that obviously did not want to go out of the house looking COVID-19-ish. And I can remember my subconscious knee-jerk reaction was something, and I didn't say it, but I'm sitting there thinking, where are you going? What are you doing? So I didn't even think about that as an issue. So, okay. So that begs the question, Shannon, if you're having those issues, how do you address them? If you're not used to talking, I feast on this. I love talking to people like this. How do you address that if you're not used to it? And this is going to be our new normal.
Yeah, I think it's the same advice that a lot of us are saying about everything. Be gentle with yourself. Be self-compassionate. Understand, okay, this is uncomfortable for me, but I'm going to try it, and I'm going to do it in small doses, and I'm going to ask for feedback from other people. Did I look weird? Did I sound weird? I felt weird. And to hear from other people, no, you're great, you're fine, can be helpful. To have a regular routine, to get up and shower and do your hair and do makeup and get dressed if that's what makes you feel good. To put on the sweats and not do anything and put your hair in a top knot if that's what feels good too. So to be just more in tune with what each of us needs and to honor that. Just because we're staying home doesn't mean you have to be dressed down. Lots of people can dress up, or they might want to do it once a week just to feel like, oh, I can still do this. Especially going back to what Sonia's been saying, to put on something with a zipper and a button and go, oh, I can still fit into my jeans. That's great. It might make us feel a little bit more normal during this time. Right. So, using self-compassion is my biggest advice about all of this. This is not a situation any of us have ever been through. So we're learning as we go. And in learning as we go, we have to be easy with ourselves, and we have to learn from one another and just be kind. Like Dr. Romano said, just be kind to yourself.
So we've got we've got as much time as you guys want. We're approaching the 1 hour mark. Is there anything we have not yet talked about, Dr. Romano, Dr. Sonia, or Shannon? Anything we haven't talked about yet that you guys want to hit on?
I mean, there's a lot. We could make this.
I know, right?
No, right.
Well, I'm on. Guys, look, I feel like I'm getting free therapy right now. So you guys just keep going as far as I'm concerned.
No, I've already put the bill in the mail.
We'll send you a bill, yeah.
True.
Right. So,
Something I want to share is a statement that I've been seeing online a lot lately. And it's just, along the lines of having compassion for yourself, especially for everyone who's working at home and their whole routine is disrupted. And I keep seeing this quote that says, "You're not working from home, you're in a crisis at home trying to work." And that really just hit home with me because so many things have changed and they're just not normal. And I'm not as functional in my work life as I typically am. I'm not just doing all the things that I used to be able to do. So reminding myself that to have more gentle expectations for what I'm capable of right now and what I'm comfortable with is really important, and advise everyone to do the same. Is just remind yourselves that it's not just that we're choosing to work from home right now. We're forced into this situation and we're trying to make the best of it.
Right. I've used the analogy of a computer with a program running in the background all of the time and how it kind of slows down the other processes. And I feel like right now our brains are all that computer with the big program running in the background, and we're unaware of how it's sapping our ability to concentrate, our energy level, all of our other cognitive and emotional functions are diminished right now. And so to know, like Sonia said, that we're in crisis and the brain and body respond, whether we're conscious of it or not, to that crisis. So we're not going to operate on the same level we're used to as a mom, as a worker, as a spouse, just as you're used to with your exercise, with your eating, with your sleeping. So to be aware of that and to know that that is normal and to do whatever you can to minimize that program in the background. And so I recommend things like yoga and meditation, anything that we can kind of consciously tap into where we're redirecting our brain rather than having it direct us all day long.
And I will, one of the things the folks in my office hear me say a lot, or at least through emails, I bombard them lately with emails, but is the installation of hope. That's a psychotherapeutic term that we have. And I actually live by that we may not get back to the pre-COVID days. It's just like when we had 9/11, things changed. I mean, you take your shoes off at the airport, but you can still fly. You can still travel, but you travel differently. And I try to tell friends and family and clients, we're going to be okay. We always come out of these things. We had the 2016 flood. We had Katrina. We have things on local and national levels that we're a strong society. We will pull ourselves back up. It'll be a little more difficult for some than others, but we have people to support each other, that we're going to get back where we need to be. It's going to be a little differently. We may not shake hands when we meet people now, but we're not going to completely avoid people for the rest of our lives. So it's going to be okay. We're going to get back. And the other thing that I have read and a lot, I do a lot of reading about, how we're going to get past this virus. And I had my trainer tell me today, ironically, we were talking, and the push, the three things, or four or two, whatever, however I collectively phrase this, is making sure that we're sleeping right. My trainer tells me, he preaches to me every day about sleeping, getting sleep, going to sleep at a normal time, make sure you're getting quality sleep. If you're having nightmares and those sort of things, then you need to address what's the anxiety, because daytime anxiety is what perpetuates nighttime dreams. And there's night terrors, and we can get into all that too, but it's different. Nightmares and night terrors are different. But don't jump to the sleep aid immediately as the way to fix your sleep disturbances. Again, the best way to do it is talk about it, talk about your feelings and your emotions. But to go back to what my guy told me, he said, sleep, exercise, even if it's just walking every day, sunlight, we are finding out more and more from what the research that and we've known this forever in psychology and mental health, that sunlight, people who don't get as much sunlight tend to maybe experience more depressive symptoms. So there's actually phototherapy, what we call it. But getting adequate sunlight during the day, that vitamin D, getting that exercise and sleep. He's actually telling me about studies that is showing ways to improve this.
So I hate sunlight. If I could be a vampire, I would, but I have found that I am outside a little bit more than I used to, and I'm loving it. As you can tell, I keep my office as dark and dank as I can. So one more time, if someone wants help, assistance, maybe just wants somebody to talk to from your office, maybe wants to set up an evaluation, guys, what is the website again, Dr. Romano?
It is www.romanopsych, ROMANOPSYCH.com.
And I will give you guys some love in this sense that if it is an issue, I'll use the word issue. If it is an issue that you guys don't treat, you are very good about finding someone that will. And I will say for those watching this, I cannot tell you on a weekly basis how often I tell people to seek help. There's nothing wrong with it. Getting an evaluation sometimes is helpful, even if it just says, hey, there's nothing going on here. So I certainly will echo that again in this room. Anything to close with, guys? It's okay if there's not.
Thank you for having us. And I think
not a problem. Look, I'm going to post this for everybody that's watching. First of all, thank you to Chelsea. Thank you to Lauren and everybody else that was in the attendees category of the webinar. If you guys have any questions out there that you didn't ask, you weren't comfortable asking, if you want to email me at info@geauxrouge.com, I'll make sure these guys get that email or that question. Dr. Sonia is a regular on my show because we're going to be doing some food stuff. She's trying to convince me to go vegan for a week, but I don't know if that's going to happen or not. And by the way, just so we're all clear, there's no misunderstandings. She was directing the weird habits at me because I'm in hour 40-ish of a 72-hour fast, and she's already chastised me about that. So I'm listening, Doc. I'm listening. So anyways, we've been talking to Dr. Brandon Romano, Dr. Sonia Blauvelt, and also Shannon Smith from Dr. Romano's office, excuse me. This is Franz Borghardt with Geaux Rouge. We wish you guys a safe and healthy day. And if you need anything from any of these guys, do not hesitate to contact them. You guys have a great day.
You too.
Thank you. Bye.